Uganda has an estimated 1.4 million people living with HIV/AIDS, and about 23,000 died as a result of AIDS-related illness in 2018. With a gradual increase in the number of people living with HIV accessing treatment, 2013 was a watershed moment when the number of new infections per year was less than the number of people beginning to receive antiretroviral treatment. In the same year, nearly 898,200 people living with HIV were enrolled on treatment. In 2016, about 1,730 health facilities operating in Uganda were offering antiretroviral treatment. However, in 2016, only 67% of adults and 47% of children eligible for access were enrolled for ARV treatment. However, there are fears that complacency, poor planning, and chronic budget gaps are reversing the gains of Uganda's relative success story and putting the lives of thousands of patients at risk.
But sometimes it just happens because you have gone to a facility and there is no medication. And that is a very big problem. Some people, especially those from the north, those from the west, there are districts that have very big sub-counties, like the distances are very long. So when you go to a facility and you're told there are no medications or ARVs are not there particularly, you would feel very disappointed. And sometimes people give up because, say for example, you have traveled 70 kilometers. We have a case in Amuru where someone has traveled 70 kilometers and probably takes 3 or 2 days on the way from the time they leave home to get their medication and back. So it is very disappointing to get there and there are no medication. And by the way, that means you're not going to take your medicines and you do not know what is going to happen. The effect might not be immediate, but eventually we have seen people with cases of visual impairment, their skin goes really bad, those that have gotten cases of TB because of the inconsistency of taking their drugs.
Much of Uganda's HIV/AIDS outreach and treatment programs depend on foreign financing. It relies on the Global Fund, the US President's Emergency Plan for AIDS Relief, and the pharmaceutical company to boost drug stocks. In 2018, Uganda received nearly $700 million to combat the HIV/AIDS pandemic. However, the rollout of lifelong prolonging antiretroviral drugs in far-flung areas poses a challenge to those living with HIV. Many health centers experience complete stockouts, and patients have to rely on private clinics to access medicine. For those who are extremely poor, they have to wait for months before they can access drugs, as shelves at health centers remain empty. Even referrals once in a while run out of ARVs, posing a threat to the fragile health of those living with HIV. For instance, Masafu Referral Hospital, which is well stocked with ARVs, has experienced a shortfall of septrin, an antibiotic which is used to treat and fight opportunistic infections like flu, malaria, and tuberculosis.
Initially, we used to get with the septrin. We also received septrin in 2000, last year, January. However, we've been getting buffer stocks from Uganda Cares. Therefore, this has not affected our clients because, as you heard when I was telling you in the beginning, most of the clients don't need septrin.
In 2018, most of the public health facilities in the country did not receive septrin. As a result of fluctuating supplies of ARV drugs, Masafu Referral Hospital hosts a large number of HIV patients from Kenya and neighboring districts.
We have always had ARVs in the facility. Occasionally, we get stock outs, whereby what we do, our pharmacist gets from lower facilities which have excess, and we refill. Because we go into shortages, being a district referral hospital, we get clients from other facilities who come here and are admitted. And during that time of admission, their refills get done, and what happens is that we are forced to give them from our stock.
Just fewer than 60% of adults living with HIV on treatment are virally suppressed. Increasing this percentage is a key target for the HIV response, as people who remain virally suppressed are unable to pass HIV to others. Ugandan men on treatment are less likely to be virally suppressed than their female counterparts, with viral suppression rates standing at 53.6% and 62.9% respectively. We spoke to people seeking services in Wakiso Health Center 4, Temangalo Health Center 2, and Seguku Health Center 2, as well as those in northern Uganda. This man could not undertake an HIV/AIDS test at Wakiso Health Center 4 because the health workers had left by 3 p.m.
Ngenza okutuukawo nga baŋŋamba nti nno abasawo bamaze okugenda bakebera omusaayi era nvudde osifunye service.
Another patient says they should improve ARV access outlets, especially in the countryside.
Eriwo gye mbadde njagala twogereko y'engeri gye tusangamu obuzibu okufuna ARVs nga ffe ababeera bazeetaaze okubeera nga tuzikozesa. Osobola otwala ogenda w'ogenza okusobola ozifuna n'okandaalirira oba n'otwala ebbanga ddene nga tonnazifuna ate nga awamu n'ekyo weetaaga obba nga ozikozesa mu budde obwo. Tubadde tusaba tubeere ng'oba oli awo twongerwako ebifo oba ba agent abasobola okuzitutuusaako mu bitundu gye tuli. Kati waliwo eno mu misoso gy'ebyalo ng'oluusi omuntu atawaanyizibwa oba transport okubeera ng'atuuka mangu ddala w'asobola okuzijja.
This man walks for 2 miles and often the health centers have a drug shortfall.
Tugenda tuuka manyi gye tuva eno nga walako okutuuka ku ddwaliro tufunire eddagala eryo. Naye tugenda okutuukawo oluusi nga abasawo tebaliiwo, oluusi nga oba eddagala nayo yennyinnyini nga terinajja terinatuuka. Kati obajja nga okukyandibadde ekyokutunnyonnyola kubabuuza nti bannaye tukoze tutya eddagala nga tetulifunidde mu budde. Taleka tugamba bye batugamba ebirala bitakwatagana naga budde bwatukutteko naffe tuva wala biki okitegeera.
He also revealed that health workers report to work late and have a habit of rebuking patients.
Ebiseera ebisinga bw'ogenda okwebuuza ku musawo akuddamu bukambwe bw'enjawulo. Tombuuza. Temubirina bitubuuza mutuleke bulesi muzze kunona mugumiikirize batuli bakuba tujja bbawa. Kale kwe ensonga gye batuddamu si bulungi.
Many patients who access treatment at Temangalo Health Center face a challenge of walking for long distances on this dirt road.
Okuva ene waffe ogenda Temangalo ku epicenter wawanvuko omuntu asobola okubulwa ssente kubanga omutwalo gusobola okuba nga guggwawo amagenda n'amadda. Naye ssente ezo zisobola okumubula ne yeekwasa nti eddagala terikola ki? Teririiyo naye ng'eddagala likola ki? Libeerayo. Ate n'ekirala ekkuba enfuufu nnyingi nnyo.
Uganda's healthcare system is ailing, underfunded and overburdened, with only one doctor for every 24,725 patients and a projected $918 million budget deficit in funding for HIV/AIDS outreach and treatment. With 70% of doctors practicing in urban areas where only 20% of the population lives, the coverage in rural areas is worse, one doctor for every 22,000 people. The outgoing State Minister for Health, Sarah Opendi, says plans are underway to build more health centers and referral hospitals across the country.
So as I speak now, generally at least 86% of the population is within 5-kilometer radius from a health facility, and we hope that by the time we conclude this financial year 2019-2020, we should be able to see at least about over 90% of the population having health facilities within 5-kilometer radius, because this financial year alone, and we should be able to conclude about 200 health center threes that are different stages of construction.
With a global target of eliminating HIV/AIDS by 2030, there are fears that without a robust healthcare system, equipped with well-remunerated medical staff, modern laboratories, and adequate drug stock, the deadline could remain elusive. Emmanuel Mutaizibwa, NTV.